Like and subscribe and click the bell icon to get new video updates.
Beds blocked and patients dumbfounded as surgeries delayed by floods. Pandemic doctors say they fear a difficult winter to come as the health system on the NSW North Coast struggles to cope in the wake of the region's flood catastrophe. Lismore mother Cheyne Paul started seeking medical help around 12 months ago for severe pain in her abdomen. After being diagnosed with gallstones, she was placed on a waiting list for surgery at the Lismore Base Hospital and told it would take about 3 months. But between the pandemic and 2 major floods, the waiting time blew out. After the floods, she was told she had been pushed further down the waiting list once again. Ms Paul said it was at that point she gave up on the public health system. "I was completely dumbfounded when they said there were 100 people in front of me after only having 4, before the floods," she said. Instead, she and her husband Scott Fisher paid about $6,500 to have the procedure done at a private hospital. Which was a pretty big hit, but at the end of the day you just can't take the pain anymore, she said. Her operation was completed by a private surgeon on Monday. It was an added strain on what has already been a tough month for the parents, who are also SES volunteers. Trying to navigate gallbladder attacks, helping the community, raising the kids, it has been a pretty bizarre month. We lost our business premise in the flood as well. Mr. Fisher said the delays to his wife's surgery had been unacceptable. "It is really devastating to see your loved one in pain for so long," he said. "Gallbladder is apparently an elective surgery. I can't see how it is elective by any means, watching her in pain day after day." Floods a perfect storm. Chris Ingall, the head of a doctors group at Lismore Base Hospital, said the effects of the floods on Lismore Base Hospital was overwhelming. "The floods cut off our nursing, our doctors," he said. "We had nurses sleeping in the ward, doctors sleeping in the ward, just waking up and going back to do a new shift." The flood has been the perfect storm for Lismore Base Hospital. It has made worse all of the infrastructure issues and brought them to a head in nursing, in beds, and in the decision-making at the executive level. The director of the district's public health unit, Paul Douglas, said the region also saw a spike in injuries and infections from contaminated floodwater. "We saw with the first flood, on February 28, that we had significant amounts of injuries, wound infections, things like that, up to about 150% at times presenting at all the different hospitals," he said. Beds blocked as patients left homeless. Dr Ingall said patients who could have been discharged weren't because they'd been left homeless or trapped by the floods and had nowhere to go. He said it was part of the reason why elective surgeries had been delayed. The acting chief executive of the Northern New South Wales Health District, Lynne Weir, acknowledged it had been a problem. People were coming in with injuries, and it wasn't appropriate for everyone to go to evacuation centres, so it did create a small problem. Ms Weir said at times, "Yes, there were people waiting in the emergency department for a bed, and again, this is because people couldn't get home because all the roads were closed. Nearly every town had a road closed." Dr Ingall said it has created a dangerous situation. "We have examples of people who've been on a cancer surgical list to have their cancer removed and then the cancer has spread. Now that increases their risk considerably." Ms Weir said people are now being directed to temporary accommodation such as motorhomes. Elective surgery ramping up again, but concerns linger. When asked about the delays to Cheyne Paul's surgery, Ms Weir said the health district couldn't comment on individual cases. She said work is underway to ramp up elective surgery at the public hospitals, as well as work with private facilities where possible. "We are casting our net as far as we can to try and ensure patients are operated in a timely manner," she said. "I do understand there have been delays, and I realize that isn't helpful for the patients. We have to understand that this has been very unprecedented." With another COVID peak and a flu season on the way, Dr Ingall said he is worried it will be a difficult winter for health. He called for a more nimble approach to decision-making to help solve the problems. I think we need doctors on the ground, surgeons, aestheticists, physicians, to have a voice in the decision-making, said Dr Ingall. A lot of us would have, if you like, solutions to these problems that we could bring to the table. ABC North Coast will deliver a wrap of the week's news, stories and photos every Friday. Sign up to stay connected. Have you been impacted by the recent floods or are having to deal with a bad